Carl, I think that that idea, that game plan is a good one.
Okay. Thank you, Jane.
Yeah, I'm fine with it. I'm
Okay.
fine with it.
Okay. All right.
I think it's an awesome idea.
That way everything's covered. I think Dr. Lundy was going to do the same thing in her class today because I sent her all the case studies last night. You know, the PowerPoints are good, and we've talked about this, you guys. PowerPoints are an overview. PowerPoints are an overview of the chapter, right? The objectives on that second page of every PowerPoint are the same objectives in your book, right? And what have we said this term? When you're studying for exams, you need to be able to understand and answer all the questions that are objectives, right? We've been talking about that. We've been talking about that for several weeks. Those objectives are the main highlighted points in those chapters. So when you start to study for each chapter, start with your objectives, right? Okay, and then I have more of my mantra on studying for the exam, but we'll cover that when I get there. So does anybody have any questions? It looks like I haven't heard any issues with anybody with the disaster case study. In fact, most of you have turned it in. I was checking the grade book this morning. Most of you have turned it in ahead of Sunday. So great. That's great. Thank you very much. And you don't have to send them to me. I got a couple of emails this week. Don't send them to me. They get populated automatically right in the book, in your grade book. Okay. I've already prepared the exams. I did that last night. I think I have them opening up Saturday morning for you guys to download, because we need to download them before next Wednesday, but I'll send you an email over the weekend. But I think Saturday morning at 10 o'clock or something, they're ready to be downloaded for you guys. Okay. And so our exam is a week from today at this time. And there were a couple of people at the beginning that told me that they had conflicts. It was like late November, early December. So if you're, and the conflicts were with clinicals. So if you're one of those students that has a conflict next week, you have to reach out to me. Okay, because you need to try and take it during one of my other two classes. And let's see, this is Wednesday's class. So you could either take it Tuesday morning or Friday morning. Okay, so does anybody, I'm just curious, anybody in this class, well, that's on here now, have a conflict with next week? Because I don't want to be dealing with this next week.
Alicia Jennings. Hey, I'll be in clinicals on
So,
Wednesday.
okay, so you're one of them, Alicia. So stay on after, please. Okay.
Okay, I will. Yes.
Yeah, stay on after. Anybody else? Alicia, did you, I think it was you that sent me the email that you said a few of you are going to have conflicts.
I think it's just me. I just have a few days I'll have a conflict.
Okay. And it's okay. All right. Stay on after and we'll talk about it. Okay. What else? What questions do you guys have? How are you coming on your vulnerable populations paper? Or should I not be asking that the day before Thanksgiving? Okay, I won't ask. All right. Everybody has their turkey thawed? I lucked out this year because I only have to cook breakfast. All I have to do is an egg bake.
That's all I'm doing. I'm making biscuits and gravy, and that's it.
Yeah, because we're going to Tom's daughter's house in the afternoon, and my only son that's in town is going to his girlfriend's house, her parents' house in the evening. So we're both having turkey. So I said, well, how about if I do breakfast? So I was at the grocery store this morning. We went back into mask mandates starting at midnight last night back here in Colorado. So I saw one person I knew in the grocery store, and she goes, hi, Kathy, where's your mask? I go, did it already start yet? She goes, yes, it did. I go, okay. And then 3 other people I didn't know asked me where my mask was. So I had 4 encounters in less than 15 minutes in the grocery store. 4 different people wanted to know why I didn't have a mask on. So anyway, I got in there and got out. So anyway, okay, so let's go cover these case studies. And you guys know how I feel about case studies. I don't really care if we see the answers to what they are. What we need to understand is the rationales. Okay, because these case studies pull out 3 or 4 questions from this chapter, and it's typically the key essential knowledge that we need to know. Okay, and the first example is chapter 4. We'll start there with ethics. Well, I always like to do a survey. Did anybody look at any of the PowerPoints or the case studies that I sent you for this upcoming week? Because if you didn't, this is all going to be brand new information for you. So I don't want you to get overwhelmed. Okay. Okay. All right, let's go to our case studies. All right, nope, that's not what I wanted. All right, we're going to start with case study 4. So chapter 4, for those of you that haven't reviewed anything, it's ethics. Okay, this is the chapter on ethics. Okay, in each of these chapters, there is sections on the study guide that we have pulled out of these chapters that we'll go through in the study guide as well. Okay. All right. So I'm not going to do all the talking. In fact, let me stop sharing for a second. Here's the deal with these case studies. If I'm going to go through them with you, you guys have to participate. I'm not doing all the talking. Okay. So we're going to go through, we're going to read the question, and I'm going to ask you why you think the correct answer is the correct answer. Okay, and why you think the others are not. And I don't like to call on people, but I can't have just the same 1 or 2 people participating. Okay, so this is going to be an interactive next 45 minutes. Okay. Everybody without a camera on, are we all in agreement with that?
Yes, ma'am.
Okay. All right. So, all right, let's get at it. Okay, so our first case study is ethics. Okay, so I'll read the scenario and then you guys can jump in with the questions. Okay, so we have Lorraine. She's a new nurse working in the public health department. She's currently assigned to a rural health clinic that's located in a remote community with a population of less than 500 residents. Okay, the nearest tertiary care center is about 150 miles away. She serves minorities who work in the nearby power plant. So already lots of information in that little paragraph. Okay. Past 2 years, some residents living and working in the community have reported unusual health problems. Okay, these health problems involve rashes, skin conditions, and respiratory illnesses. Okay, in addition, the residents report that they think they're having a higher rate of birth defects and miscarriages compared to with other rural communities of similar size. Okay, so there's your scenario. So what are we pulling out of there? Rural community. What else? What other information are we pulling out of there? What happens in a rural community with regards to access?
Poor access.
Limited
If you're
access.
50 miles away.
Okay. Okay. What about the experience of the nurse?
Is a new nurse.
She's a new nurse. Okay. What about the environment? What kind of environmental risks are we talking about here? Where is this rural community located?
Near a power plant.
Exactly. Okay. Yep. Okay. And then in our second paragraph, what have we've identified unusual health concerns? Okay. So the first question is about ethical questions. So sorry, I don't mean to keep interrupting and keep letting people in. I'm supposed to have 2 full classes because I don't have a Friday class this week. So all my Friday peeps said they were coming yesterday and today. Okay, so in considering the environmental concerns of the residents in this community, I'm going to not show you the rationale. I don't care if you see the answers. In considering the environmental concerns of the residents of this community, which of the following ethical questions does she need to consider? Okay, I've highlighted the correct answers. So let's talk about why those are correct. Okay, so remember the topic is ethics. Why does she need to consider these particular questions?
Because she has a responsibility to the community.
Okay. Yes, so that would apply to A and probably a little bit E. Yeah, yeah. What else? She is the rural community nurse.
She's responsible for how she serves.
Right. Right. B and C are really not a concern at this point. Okay, we need to make sure she is able and willing to serve. Correct? So let's read this rationale. It's a good one. Ethics is both the process for reflection and a body of knowledge that addresses questions such as the following. How should I behave? What action should I perform? What kind of person should I be? What are my obligations to myself and others? We know that community practice is traditionally based on utilitarianism, right? Which adheres to the axiom of the greatest good for the greatest number of people. Okay, and it supports the position that maximizing benefits to socially disadvantaged groups ultimately benefits society as a whole. So remember what's our topic? This is ethics. This is ethics in community nursing. Really big deal. Ethics in any part of nursing is a really big deal, but community, you're going to face the gamut all the way from, because you're caring for the population in all stages of life, right? So you may be dealing with ethical issues with the newborns, with the kids, with the adults, with the older adults. Think of all the issues that can come up. Okay, so community practitioners work to increase our participation in health promotion and to manage chronic diseases, right? We see these actions as benefiting both the individual we're serving in the community. So does that make sense? That rationale? These rationales have a great deal of learning in them. Okay. Let's go to the second question. Okay, I've highlighted what it talks about, ethical theories. Okay, so to answer this, we are going to have to look at the rationale, because if you guys didn't do any prep work, you don't know what the ethical theories are. So which of the following ethical theories are most appropriate to consider in dealing with a rural community? Okay, well, the good news is we have the right answers of A and B, but the good news is A, B, C, and D give you the definitions of each of these. So let's just forget the right answers right now. Let's just read through the answers. So these are your ethical theories: distributive justice, beneficence, autonomy, and virtue ethics. So if you were going to be asked a question about ethical theories, what might it be? Maybe a definition question? I don't know, right? This might be a good, this would be a good, we'll get into this is also in the study guide, but this might be a good flashcard with these 4 definitions. You know, we could present a scenario and you're asked to pick which ethical theory it applies to. Okay, so read A, B, C, and D as definitions of ethical theories if you haven't prepared for class. There's your ethical theories. Okay, and then the question is asking, what theories should we be dealing with the rural community? Okay, and the answer is distributive justice and beneficence. So let's read the rationale to understand why. It's going to be hard for you guys to answer the why they're right, why they're wrong if you haven't done the prep work. Does that make sense? So we'll just keep going. We'll just keep going through it. Okay. So here's the rationale. Whereas the respect for autonomy and non-malfeasance are often emphasized more in the acute care settings, okay, beneficence, which is, you can read above what it is, and distributive justice are emphasized more in community and public health. That's huge. Okay, so that first sentence breaks down the four ethical theories. It says 2 of them are emphasized more in acute care, and 2 of them are emphasized more in community and public health. Okay. You picking up on this? So
Yeah.
I just don't want you to blow through these rationales. That's where the learning takes place. The rationales explain why it's right and why it's wrong. Okay, let's finish up with the rationale here. Distributive or social justice refers to the allocation of benefits and burdens to members of society. Okay, and then benefit refers to basic need, including material and social goods, liberties, rights, entitlements. Okay, some benefits of society are wealth, education, and public services. Well, we know that to be very true, right? Okay, the third question talks about an environmental assessment. Okay, so an environmental assessment is conducted which reveals that the population is definitely being exposed to toxic drinking water. Which of the following ethical tenets is related to the dissemination of information? Okay, so obviously the answer is A, to do no harm, but let's read why. Okay, so the ethical question related to do no harm is the following, and here's your answer right here. Is disseminating appropriate information about the groups and populations morally necessary and sufficient? The answer to morally necessary is yes, and the answer to morally sufficient is no. Okay, so here's the teaching. An ethical question related to moral character or virtue ethics is the following. Do the persons selected to develop, assess, and disseminate community knowledge possess integrity? Another important aspect of ethics, integrity. An ethical question related to competency could be the following. Are the people assigned to develop community knowledge adequately prepared? And the question is important because the research measurement and the techniques used to gather the information about groups and populations usually differ from the techniques used to assess individuals. That's a whole bunch of mumbo jumbo. I get that. Okay, but going back to the question, you're doing an environmental assessment. Okay, and you have determined that the population is being exposed. What are the proper ethical questions? Are the people doing the assessment competent? Do they have the goal of do no harm? Okay, so that's our ethics. Okay, we'll cover more of that in the study guide. Okay, parts of this will come up in the study guide. Okay, you'd be amazed at how much information from the rationales comes up in the study guide, which is why I send them to you every week. You know, they're not meant to add more work to your plate. They are meant to, whenever you have opportunities to look at rationales, I know you do in Kaplan, right? I know you do in case studies. Please, please take advantage of rationales. I can't stress that enough. Okay, let's go to our next chapter. Okay, this is kind of my chapter. Cultural influences in nursing. Okay, this chapter discusses cultural competence. What does cultural competence mean to you guys?
To make sure that no matter who we're serving, not only do we give the best care that we can, but also not to make our patients or ourselves uncomfortable and basically stick our foot in our mouth.
Yeah. Brittany, what's your version of cultural competence? What do you think it means?
It's pretty much like you understanding and pretty much being open to everybody's beliefs besides your own, and not being like, closed-minded.
Okay. John, what do you think cultural competence is? John, you with us? Okay, what about Ashika? What do you think about cultural competence?
Understanding others' culture.
Okay. Right. So cultural competence means we need to be competent healthcare providers, knowing we live in such a diverse society now with so many different cultures. We need to be aware, up to date, willing and able to accept the beliefs and values of other people's cultures and be able to provide competent care. Right? How do we gather that? We're going to learn about that. I think it's here in the ration in these questions. So this question is all about why cultural influences are there, and they're there and they're here to stay. Why we have to work on checking our own beliefs and values and how we feel. Right? This comes right from ethics as well. You could apply ethics to this chapter as well. So Nancy is a public health nurse working in a clinic that provides services to communities of Hmong immigrants. Okay, these individuals are applying for immigration visas and are required to undergo a medical screening exam. The primary purpose of conducting these exams is to determine the presence of any communicable diseases and to vaccinate according to CDC and prevention guidelines. Okay, so the Nancy typically is the first person to initiate contact with the new immigrants. She does not speak the same language as the individuals who report to the clinic, but she has access to an interpreter. She's aware the clients are nervous about seeking care because they are unfamiliar with US practices. There is a lot of information in here. Okay. There's a language barrier, so she has to get an interpreter. Right? She understands that the clients are nervous because they don't have any clue what the US healthcare system looks like and practices. Okay. We know we're dealing with the Hmong immigrants. Right? We need to determine any presence of communicable diseases and opportunities to vaccinate. So lots of information. Okay, so the first question here is, I've highlighted the word immigrant. Okay, one of the important distinctions that's made in the PowerPoint and the chapter is the difference between immigrants and refugees. So we need to understand the difference between those. Okay, so the first question is, public health nurse providing service to immigrants should be most concerned with which of the following? And again, if you haven't read the chapter, we're going to have to go right to the rationale. Okay, so the nurse is most concerned with what? being knowledgeable about high-risk diseases of the population. Okay? So with regards to the rationale, nurses need to know if there's specific risk factors for a given immigrant population. Okay? There's a couple of boxes in this chapter that talk about different cultures of immigrants and give specifics on attitudes, beliefs, fears, barriers. Okay. So for example, and this rationale goes through it. For example, Southeast Asians are often at risk for hepatitis. Okay. Hepatitis, tuberculosis, intestinal parasites, visual and hearing and dental problems. Most of these conditions are either preventable or treatable if managed correctly. Okay, so when we're working with immigrant populations, we must consider how our own background, our own beliefs, our own knowledge may be significantly different from those that we're caring for, right? Language barriers, right? Nurses need to understand the non-traditional healing practices. And again, there's a good box in the chapter that talks about, it goes through, I believe it goes through Asian population, African-American, Latino, Hispanic, and Indian, Native American. And it goes through non-traditional healing practices. So on the exam, if you're given a question that this particular group of people like to use a particular non-traditional healing, you're going to have to be able to identify which culture that is. Okay. Okay. So the first rationale deals with our beliefs. How do our beliefs and attitudes affect the way we care for immigrants? And also it deals with what are some of the barriers for immigrants? Okay, so the next question. The nurse who speaks English and Chinese, she's dealing with the Hmong immigrants. I hope I'm pronouncing that right. So anybody can correct me. They speak Laotian as their primary language, and they're completely unfamiliar with Western medicine. Okay, so here's the main question. How is cultural competence demonstrated in dealing with this population? Okay, so correct answer is B and E, but you need to know about this population, right? So the nurse provides care while paying attention to beliefs about pain, touch, modesty, and eye contact, right? She also provides care. Nurse also provides care that acknowledges the difference in ways that individuals respond to illness and treatment. So again, this is a cultural competence. How is cultural competence demonstrated? Okay, and this is an excellent rationale. Cultural competent nurses function effectively when caring for clients of other cultures. That's cultural competence. Okay, nurses who strive to be culturally competent respect people from other cultures and value diversity. And by doing that, it helps us provide more responsive care. Okay, so this whole rationale is about cultural competence. Cultural competence includes acknowledging the fundamental differences in ways clients and families respond to illnesses and treatments from maybe your beliefs, from our healthcare perspective here. Okay, differences can be in dietary practices, pain, death and dying, modesty, eye contact, closeness, and touching others. Everybody looks at it differently. Every culture looks at all those differently, right? Okay, question 3, you do need to know what A, B, C, and D are. Okay, even though the correct answer is D, these all are part of how do we become culturally competent? Do we have the desire to want to do it? Do we have the skill to be able to perform it? are we aware of the cultures? Okay. Do we have the cultural knowledge? So she attends a class. So she's trying to reach out here. She attends a class at the local Laotian Cultural Center so that she can learn more about the customs and practices of the community she serves. Okay. This demonstrates which of the following elements of cultural competence. Obviously, the answer is cultural knowledge. Okay. So by her reaching out to learn more about the community, she's demonstrating cultural knowledge. But we need to understand what the definitions of A, B, C, and D are. They're in the rationale here. Okay, so you may be given a scenario similar to this, or a scenario like this, and it may say, you may be asked to identify which element it is of cultural competence. This particular question is cultural knowledge. So we know that cultural knowledge is information about organizational elements of diverse cultures and ethnic groups, right? The emphasis is on learning about the client's worldview, what their perspective is. Okay, and when we have an understanding of a client's culture, it definitely decreases misinterpretations and misapplication when working with the clients. Can you see how that would happen? I mean, that happens all the time. Let me finish reading this. I want to ask you guys a question. All right, so let's go through the other culture. So we're going through A, B, and C now. Cultural desire refers to your motivation to be culturally competent. Cultural skill refers to your effective, how you integrate your cultural awareness and knowledge into the skills necessary to care for these individuals. And then cultural awareness, the correct answer, or excuse me, I'm sorry, correct cultural awareness is the self-examination and the in-depth exploration of your own beliefs. So you guys give me some examples where you've observed or you've been part of a situation where you've been caring for clients of other cultures and it's been challenging or it's worked well. Give me some examples, because everybody's worked with different cultures.
A couple weeks ago when I was doing my clinicals, there was a patient there who did not speak English and the wife did not speak English, and they were tired of waiting for an interpreter, and I'm just like, use Google Translate. And so I literally sat there with the patient and had a long talk with them over Google Translate, and figured out what was actually going on, how he was feeling, et cetera, et cetera. And, you know, we were able to get to the bottom of what was going on.
Excellent. Excellent, Lisa. Thank you for sharing. Anybody else?
My experience has not been in the medical field yet. I've not had the opportunity. But whenever I was working in the funeral industry, our organization worked very closely with the Egyptian Ethiopic Church, Christian Church, and then as well as the local Laotian community.
Okay.
And the customs and everything as far as death care, completely different as far as what we in the West would typically do.
That's a perfect example of having to learn to be culturally knowledgeable in that particular, with that particular population, dealing with that particular issue. Anybody else? Don't make me call on you guys. Just please speak up. Everybody has had an example in one way or the other with cultural norms. Tiffany. Tiffany, give us an example.
I used to work in a doctor's office, and one of my patients, he spoke a little English. And when I would talk to him, he wouldn't look me in the eye. Like, he would always look at the floor. So eventually, once he got a little comfortable, he started looking in the eye, and from his little English, we finally came to like an agreement, and he understood what his patient care should be.
What particular culture was he?
I don't really know. I'm
Mhm.
not sure exactly what his. I don't
Yeah.
know, but he wasn't from America.
Okay. Okay. So another example. Okay. Thank you. Okay. Let's jump into case management, which is chapter 13.
Can I
Oh, go
share
ahead.
an experience?
Yeah.
Um,
Who's speaking?
Ashley Moore.
Okay, Ashley, go ahead. Thank you.
I had a patient that was Muslim, and she didn't really share during her admission history that she would pray to Mecca multiple times a day.
That she what?
She would pray to Mecca.
Oh,
So, I went in to get her vitals, and this has been a few years now, but I found her in the floor, and she had a blanket down, and she was praying. Well, of course, I step out, I let her finish her thing, and then we had to come up with a game plan, like, what times do you pray? What times can we work around your schedule? So that was pretty neat to experience.
Yeah. Yeah. Really neat. I have an experience of I have an elementary school from last year that has a very large Hungarian population. And the kids, lots of issues with vaccinations, just issues with a lot of things. And I spent the entire year learning about the Hungarian culture and why vaccinations are important or are not important, what their cultural beliefs are with regards to that, what their cultural beliefs are as far as kids come into the clinic and what we can do and what we can ask. So, yeah, I consider it a opportunity to learn. Gaining cultural competence to me is an opportunity to learn as much as I can about as many different cultures as possible. Okay. What do we do as a case manager? What's a case manager?
You assess their needs and help fill them, like whether it be like, I don't know how to really explain it other than, I've seen case managers come in and they take and help us figure out what the patient needs and help them get what they need in order so that they can continue with a good quality of life.
Yep, that's part of it. But let's read the rationale. We're going to jump right to the rationale for question number 3, because it tells you exactly what case management is. Okay. And we as nurses function as case managers all the time, sometimes formally, but a lot of times informally. Right. So case management practice it becomes complex because you as a case manager are the coordinator. Right. You're coordinating activities of multiple. It depends on what you're case managing. All right. You may be working with payers, insurance companies. You may be working with discharging patients going home that are going to need home equipment, oxygen, maybe physical therapy, occupational therapy. You may be dealing with not only the individual who's ill, but the family members and having to teach them things. Okay. So you are the coordinator of organizing all that care. All right. Care by multiple providers. Okay. You're going to be organizing all that. And you're right, Lisa. You must be assessing, planning, implementing based on your mutually agreed goal. So what do you think about when you hear you must be assessing, planning, and implementing? What are we doing?
Observation.
There? We are taking our ADPI, right? we are taking our ADPI and transforming it into the case management world through assessment, planning, implementation, evaluation, right? Remember what we've talked about every week is we have to be able to take our ADPI and apply it to different situations in the different topics we're covering every week. So here is how case management is advocated through the or here's how the ADPI is advocated through case management. Okay, and then case management also includes electronic delivery, electronic care delivery through telehealth, case management. We're now doing it through telephone, email, fax. I don't really know. Do we do faxes? Yeah, I guess we do. Videos. I mean, look what's happened. And then the last one is home visits. Look at what's happened over the last 2 years. Look at all the different ways we've learned to communicate differently in the healthcare setting with telehealth, right? So that's essentially what case management is. Let's go through the questions. Okay. We're getting kind of short on time here. I don't know if I'm just spending too much time on each of these. We'll go as far as we can get, but I do want to stop at 4. So what time it is? 4, and I promised you a review, so we will get to that. All right, so let's keep going. Local regional center is partnering with a home health agency to provide disease management to frequently admitted patients with CHF. The administration of the medical center has identified that there are multiple readmissions every month to the same unit. So a core measure data indicates that appropriate medical intervention and nursing education has been conducted repeatedly to those patients who continue to seek medical care. Okay, so now the home health agency is collaborating with the cardiac telemetry unit to identify patients being discharged with the diagnosis of CHF. Okay, a case manager is assigned to make follow-up phone calls daily to monitor symptoms, signs and symptoms of exacerbation. Okay, so a home health nurse may be assigned to visit the patient if criteria are met. Okay, so here we need to know a little bit about CHF management. So what are the anticipated outcomes of CHF management? Well, here's our correct answers. We want to interrupt the development of the disease, reduce emergency visits, greater client provider satisfaction. Okay, so this is a really important rationale about chronic disease management. Okay, and how case managers get involved. So clients with chronic diseases benefit from a disease management approach. Okay, promotion of wellness. I'm just going through this quickly. Promotion of wellness is necessary for success. Okay, disease management programs also reduce emergency visits. So this is what the case manager, that would be her role. They want her to monitor the outcomes of CHF disease management to reduce readmissions. Okay. Here's a number 2. The ethical principle of justice is encountered by the case manager in which of the following issues? Well, you have to know what the ethical principle of justice is. So we're going to have to go to the rationale. Justice, as an ethical principle for case managers, considers equal distribution of healthcare with reasonable quality. Okay. Tiers of quality and expertise among provider groups could be created when quality providers refuse to accept reimbursement allowances for the managed care system. So what this means is equal access. So let's say you have a new drug that's come up, and you have a patient that you think may benefit from it. It's really not FDA approved yet, but you think that maybe talk to the doctor because this patient can't afford it. Maybe talk to the doctor to see if maybe providing this new medication to this patient at no cost will still be cheaper than all the complications and readmissions for the future if they don't take it. Does that make sense? So you need to be an advocate for the patient. That's part of the ethical principle of justice, right? Equal distribution of healthcare with reasonable quality. Right? We don't want to leave less experienced or low quality providers as the caregiver for a certain population. That's not fair and equitable. Okay. And then question 3 deals with telehealth. What are the benefits of telehealth? Okay. So you can read that. You can read that one. Kind of already talked about it. Okay. Disaster management. Okay. Disaster management's real important with regards to community and public health. All right. So local home health agencies are meeting to participate in community-wide disaster drill. Those in attendance are the administrators from 6 different agencies of a community in Central California. Community has identified that it does not lie in an earthquake prone zone or flood area prone area. It does not lie. Okay. Disasters that occur are generally related to multi-casualty freeway accidents. Okay. Well, doesn't mean it can't happen, right? The agencies are completing a training drill to plan for the response in the event of a communicable disease outbreak. When they have conducted the drill, each administrator is responsible for educating their staff nurses about the findings and the response to the plan. Okay, I know these select all that applies are difficult, but let's read through it. What are the considerations for the nurse in responding to a disaster? Well, A, B, and D are your correct answers. Okay, but let's read the rationale. Nurses who are disaster victims themselves and must provide care to others will experience considerable stress. Conflicts between family and work-related duties are inevitable, right? For example, a nurse who is also the mother of a young child will not be able to participate fully. Okay, so advanced personal and family preparation can help manage some of these conflicts. Okay. In addition, the nurses assisting in disaster relief efforts must be healthy as possible, both physically and mentally. Okay, so this question addresses really as a nurse, and it talks about this in the PowerPoints and the chapters, as a nurse, we are really kind of expected to function in all different phases of a disaster, right? Pre-disaster planning, post-disaster. Okay. So the expectation is that we have all of our other things in order to be able to participate fully. Okay. Because we as nurses may be disaster victims ourselves. Okay. Number 2, what are the essentials for baccalaureate prepared nurses to understand disaster preparedness? What is the purpose of an adequately prepared nurse? Right. So adequately prepared nurses can serve as leaders and enable others to have a smoother recovery phase. Okay, and you can skip the baccalaureate prepared because this is pretty much a general statement. One of the essentials is to understand disaster preparedness. It doesn't matter where we work. We're the nurses, wherever you work, and however educated, whatever your education is, we are expected to participate in disaster planning, disaster preparedness, disaster drills, all phases of disasters. Okay, so public health nurses need to be aware and understand disaster plans at the workplace and in the community. Do you guys know what your disaster plan is in your workplace? Do you know where to go get it? Do you know where to find it? If you don't know what it is, do you know what your role is? Yeah, exactly. What about in your community? Depending on where you live, are you hurricane prone, tornado prone? Do you guys know what your community's disaster plan is in the event of a disaster.
In our town, it's a big old siren that goes off, and then they like set the siren off on the first Saturday of every month just to make
Awesome.
sure make sure it's working and everybody, practice drill.
Yeah, we do that in our community too. I think it's I don't know if it's every month, but yeah, we have a big siren that goes off for tornadoes. Yep. So public health nurses need to be aware of the understanding that disaster plans, they are in the workplace and the community. Nurses take time to read and understand workplace and community disaster plans and participate in drills in the community mock disasters. Has anybody ever participated in a community mock disaster? It's pretty cool, actually. Has anybody done that?
No,
When
I
everybody,
haven't done that.
go ahead.
No, I've never heard of that actually.
Yeah. We here in Denver, once a year in the early fall, it's out at the airport, and it's a mass disaster drill, mass casualty drill, involves everybody: fire, police, hospital, setting up mobile tents, triage. I mean, hundreds and hundreds of people participate in this drill. It's
They do
real.
that in Nashville. Yeah, they do that in Nashville too, at the Nashville airport. And it's huge. And they usually advertise it. They usually ask for volunteers.
Volunteer
And
patients.
It's really
Yeah.
a huge thing. And here in Cumberland County, we have something similar. It's not near as big, of course, but we actually, for those of you in Cookeville, if you ever go over to Bravo's, across the street from Bravo's, there are the horse trailers that say Putnam County, and those are the things that we would pull out that are stocked. They're little exam rooms, and that was what we would stock and pull out into the community when we go and respond to a disaster. And we got those just a couple of months ago after the tornado came through and devastated part of Cookeville. We went from Mount Juliet all the way down, but we got them after that.
Yeah. Nobody thinks, thank you, Ellen. Nobody really wants to talk about disasters until they actually happen. But we as nurses have to be part of that process. We have to be part of that discussion. Okay, we are a trusted source of information, and it talks about this in the book, that nurses really kind of are expected to function at any level and stage of a disaster. Okay. Go ahead.
I was going to say, since I've been in nursing school, I've helped my mom a couple of times do mass casualty training as a victim that go in. It's more of on the tactical side, military wise, but I was, what better yet to learn what they're doing on the tactical casualty class. Kind of
didn't you post pictures on Facebook of the wounds that you guys created? They were awesome.
Thank you. Yeah, we kind of took it. My mom is in the State Guard and she's an instructor, so all of the guys that are fixing to deploy, they have to go through this TCCC class before they can go, and I get roped in as a voluntold. I show up and get told whatever I'm gonna do.
What am I missing?
You never did bring me that roast, woman.
Well, considering that roast got open wound packed, don't think it was worth cooking.
It just adds flavor. I'm just kidding.
Yeah, so thanks guys for sharing. We can never be prepared enough for a disaster, and we're the ones that the community looks to when something happens, right? Okay, which of the following interventions is tertiary? is a tertiary prevention measure related to disaster management. Okay, I'm not going to show you the rationale yet. Why is D the correct answer? Anybody should be able to answer this, whether you've looked at the book or not, because you should know what tertiary is.
It
Why is
says
that?
additional injury, so there's already a problem.
Excellent, excellent, excellent. Who said that?
Fine.
Fine, good job. Okay, so with tertiary, the injuries have already happened. It's the aftermath now, right? So now we're working at maybe visiting individuals to make sure there's no additional danger. Okay. All right, so participating in home visits to uncover dangers that may cause additional injury. They already have the initial injuries, right? So to uncover additional injuries or to victims or rescue personnel is a tertiary prevention measure. Okay, and it gives you an example of primary and secondary. So a primary prevention would be to participate in the development of the disaster management. So that's the prevention phase, right? Nurses need to be part of that planning. Okay, and then in the secondary prevention measure would be assessing, kind of triaging, assessing and triaging victims of a disaster. Right? Remember, I talk about secondary as early identification, early intervention. Okay, so that's our disaster chapter. Surveillance and outbreak. I don't have any yellow in here. So let's see, it's 158. Let's do this one. And then 16, 17, I'm not worried about too worried about 28, which is local, how we're involved in local and state initiatives. You can read that on your own, but you are going to have to do 16 and 17 on your own. Okay, as far as case studies. Let's do this one, and then let's get to the review. Okay, so this is about surveillance and outbreak. Okay, so one of the primary roles of a public health nurse in any community is to monitor outbreaks of communicable diseases or infection. That's key. Okay. We're also responsible for reporting certain conditions to local and federal agencies. Okay, so for example, in the schools, we have a whole list of reportable diseases: pertussis, chickenpox in the preschool setting. There's a national registry of what needs to be reported, but each state also has reporting requirements as well. So you have to be familiar with those, right? So when we do disease surveillance, it allows us, the nurse, public health nurse, to monitor for trends, set priorities, and evaluate the necessary programs in the community. Okay, so there's a really good summary of why surveillance is so important in public health. Okay, so here's our scenario. Elementary school nurse contacts the public health agency to report that several children had developed symptoms of the whooping cough. Okay, so the school district now has requested the nurse provide education to the parents about what the signs and symptoms of pertussis are. In addition, we need to pull immunization records to make sure students have an accurate vaccination history with pertussis. If any student needs a booster, they're being contacted. Okay, so one of the things that's extremely important is collaboration, right? In any disease outbreak, any disease outbreak or infectious disease, communicable disease, collaboration. All right, this is an important question. What information is communicated to the members of the community? Okay, this is a select all that apply. Okay, so you need to be aware of this because there's certain things that you don't communicate and certain things that you do communicate. All right, so here are the correct answers of what we do. All right, why is A and B incorrect? This should be a no-brainer.
That's a HIPAA violation.
Does everybody see that?
Yes.
Okay. So excellent rationale coming out. Okay. Quality surveillance system requires collaboration among many different agencies. All right. It may be local, state, federal, hospitals, healthcare, doctors, vets, agriculture, pharmaceutical agencies. I mean, think about all the collaboration of who potentially needs to be at the table, who potentially are the key stakeholders, right? These are, I mean, this up to here gives you examples of who might be involved. Okay. So with this kind of collaboration, that promotes the development of a comprehensive plan and a directory of emergency responses and contacts for effective communication. I mean, you have to be able to think ahead about any kind of outbreak. Who needs to know? Why do they need to know? Who doesn't need to know? Okay, so collaboration promotes the development of a comprehensive plan. Okay, information shared includes who's responsible for the action, how to use the algorithms, how to investigate, and who to contact. Okay. Reporting of national notifiable diseases is essential for what reasons? We just talked about that. Okay. So we monitor trends, safe for pertussis. We do that in schools. Okay. Potentially, we're detecting the beginning of an outbreak. Okay. And then we can use that information to do prevention programs. So send out a letter, meet with parents, talk about signs and symptoms of pertussis. Okay. So our rationale: reporting of disease data by healthcare providers, labs, public health workers to state and local departments is essential. Okay, so even though I may report a case of pertussis to the local health department, if I get a call from the parent, actually the physician, the pediatrician, is also required to report it, and the lab is also reporting it. So they may have 3 different reports on one particular kid. Okay. Okay, so the data provides basis for detecting disease outbreaks, okay, for identifying personal characteristics and for calculating incidence, geographical distribution, and temporal trends. All right, this is all used to initiate prevention programs. Okay. A group of elementary students becomes ill after a teacher uses a dry erase marker for demonstration of a math problem. The students are coughing, they have headaches, itching throats. This is an example of which kind of pattern of occurrence. So, guys, if you haven't looked ahead to this chapter, you probably don't know what these are, but you need to. Okay, you will get asked about this on the exam. You will be given a scenario of an outbreak, and you'll be asked to identify which source of an outbreak it is. Okay, this rationale gives you the definitions of those. Okay, it's also in the book. There's a box in the book that goes through each of these. Okay, and this is a good rationale because it gives you an example of each. Okay, so common source refers to a group of people who've been exposed at the same time and everybody gets sick. The example they give in the book is a release of a gas in a train, an underground train. Everybody's exposed, everybody's going to get sick. Okay, that's a common source. A point source is everybody's exposed at the same time during an incubation period. Okay. I'm sorry, the mixed outbreak, this is a good one. Mixed outbreak occurs, say, with the flu. that everybody's exposed, but you keep passing it from person to person to person, kind of like COVID. So COVID is a mixed outbreak. Okay. And then intermittent, you're exposed over a period of days or weeks, and people get sick at different intervals. And that could be, say, food poisoning. Let's say a restaurant got a shipment of bad lettuce, but they use it for 2, 3, 4, 5 days. People are getting sick at all those different intervals. Okay. So you need to know what these are. Okay. They're called patterns of occurrence. And we'll talk about these in the study guide. Okay. So surveillance and outbreak. So what are we missing? Program management, you're going to need to read about these. This is setting up programs, educational programs for the community. How do you do that? Right? What's the primary purpose of planning a wellness program? Okay, so this is setting up programs. So you're going to need to read through that. Okay, and then 17 is managing quality and safety. We'll go through this in the study guide, but this talks about the difference between quality assurance and continuous quality improvement. Why is quality, I mean, you hear about in your hospital settings, quality departments, QA departments. Why is quality and safety also important in the community setting? Or probably more important in the community setting?
You're giving the same quality of care to everybody.
Well, and remember, as community nurses, we're much more autonomous, right? We are caring for individuals over an entire lifespan. We need to have lots of skills, right? We're bringing in everything: med surg, peds, elder care, adult care, right? Quality and safety is just as important as in the hospital as out in the community. Right here. Take a look at, I want you to read it. If you get to this, I want you to read question 3's rationale. Okay. It talks about quality programs, initiatives. Okay. It talks about Department of Human Health and Services and who's responsible for providing us these quality standards in community health and public health. Okay. All right, let's go to, I want to go to the study guide. You guys have your study guide out, ready to roll? Is anybody taking a look at the study guide yet?
Yes, yes, ma'am.
Okay, everybody pull out your study guides and let's take notes. Okay, I'm not going through, you can read the front page on your own. Okay, as always, it's broken up into different chapters, different sections. Community assessment and evaluation is the first one. We did that last week, right? Okay, so what do we need to know? We need to know that the community, do you guys know about the 3 different dimensions? All right, you need to know about the 3 different dimensions, that a community is made up of a place, geographical location, people, who makes up the community, and what's the function of the community. Are they an industrial community, an agricultural community, a college town? You need to know those 3. Okay, and the rest of this gives a little synopsis of each of them. Okay, one, measuring the people, right? Where do you get the data? So remember, we're doing a community assessment, so we're trying to collect data. So if we're trying to collect data on the people, where are we going to get the information? Okay. If we're trying to collect data on the place, how would we get information? All right. So this paragraph is understanding how we gather information about these 3 different dimensions: people that make up the community, the place of where it is, and the function. Okay. Next paragraph. What are the systems that make up every community? Some may be more important than others, depending on the community. But there are 5 systems categories found in every community. They're politics, education, recreation, economics, and religion. So, what kind of question might you get about identifying the common systems categories for like any community? Maybe select all that apply, or what do you think? Anybody?
I'm thinking select all that apply.
Okay. Remember, there's 5. You got to remember all 5 of them. Okay. Up here, what about up here? Dimensions. Maybe you have a question that it go both ways. That, let's see, we have gathered information from census data, tourist bureaus, civic groups, churches. What dimension is that? Is that place, people, or function? Right? Or maybe dimensions of community is function. Select all that apply. Okay. Okay, next paragraph is about active. What do we know about active and passive community partnerships? Why are those important? And what's the difference between the 2 of them? What are community partnerships? You all have them in your communities. What are they? I don't want to start calling on people. What do you guys know about your own community and what partnerships you have in your community? Do you have businesses that step up to do certain things for the community? Maybe food banks?
Like the health department?
Yeah, health department, sure. Okay, so the difference between active and passive. So an example of an active community partnership would, I don't know, let's say a local business provides money for purchasing food for after school programs. They're actively participating and having a direct effect. Okay, these kids are getting meals every day. Where a passive partnership could be a bunch of community leaders sitting around planning for a new rec center, planning for something in the community. They're partnering with the community, but it's more of a passive role. Does that make sense? Here's the examples they give. A city creating a new park, hospital providing vaccination clinic, rec center offering cooking classes. That's a passive partnership. Okay. And here's your example of the active right here. Business that provides low-cost snacks to an after-school program is an example of an active community partnership. So you need to know the difference between those 2. Remember, we're still in the section community assessment and evaluation.
Is the passive one because they'll be taking like donations for something?
Could be. Could be. Yep. Yep. During a community assessment, the nurse will perform data gathering and data generation. What's the difference between data gathering and data generation? Need to know that. Well, think about it. Data gathering is from information that already exists. You're gathering it. Right? So data generate, let's go through data gathering first. Data gathering is the process of collecting information that exists already, such as age of the residents, racial distribution, health care organizations. You're gathering data that already exists. Okay. Data generation on the other hand, is the process of identifying data that does not exist, right? That's developed through, say, interactions such as meeting with people in the community. Okay? Meeting with people, talking about their values, beliefs, and social norms. Okay? That's not already gathered. In order to generate data, you're going to have to get in there with the community and be talking to people. What are their values? What are their beliefs? What are their social norms? So we need to know the difference between those two. And then you guys should already be able to articulate what a windshield survey is, right? Anybody need me to go through that? Doesn't matter where you're looking from, your car, the bus, the train. Doesn't matter. Okay. So that's community assessment and evaluation. That's kind of a big area. Next one is evidence. What's evidence-based practice?
It's like theories that have been tested by nurses to see if they're accurate, kind of something like that.
Okay.
They'll find something, like they'll take a diagnosis, and whatever goes with the diagnosis, they'll pretty much test to see if it's accurate before they use it.
Okay. All right. Anybody else want to contribute? Okay. Along those lines, it provides an environment to improve nursing practice and client outcomes. Okay, it's called evidence-based practice. Okay, you're trying to always be looking for the best research, the best way to care for, let's say, here's an example. Let's say there's 6 hospitals in a community, and 2 of the hospitals are doing really well with discharging stroke patients in 3 or 4 days, where the other 4 they're being discharged, they're in there over a week. What are those 2 and have positive outcomes? What are those 2 hospitals doing to get these patients out earlier? What are they doing differently? Okay, maybe the other 4 can learn from that. Sharing information, right? Because we all want to be providing the best evidence-based practice. So the way we cared for a stroke patient 20 years ago is a lot different than we do right now. Why? Because over the course, there's been research, there's been articles, there's been lots of data generation of how we could do it better. Okay. So one of the problems of evidence-based practice is, does anybody work with anybody who, let's say you work in a stroke unit, okay? Does anybody work with anybody that says, oh, no, the way we do it right now is fine. We don't need to change anything. Anybody work with those kind of people? Don't need to change anything. One of the challenges of evidence-based practice is recognizing our own beliefs, right? And that's actually a barrier. Okay, so the first step toward implementing evidence-based nursing is recognizing the current status of one's own practice and believing that the care based on the best evidence will improve outcomes. That's a big hurdle for some people to climb, because a lot of people just like the status quo. All right, the barriers to adopting and implementing new technology, willingness to embrace new types of documentation, new ways to document things, new technology, new machines, new everything. Everything is always changing and updating, right? So what this deals with, that's what evidence-based practice is, but this is presented to you as what might be some of the barriers of implementing this, this paragraph. All right. So that's evidence-based practice. I mean, ultimately, we want to be part of always using the best evidence-based practice, right? to increase the health and client outcomes. Okay. I mean, look where we started with COVID. Take COVID, for example, for evidence-based practice. 2 years ago, we didn't know a lot. Well, through so much activity over the last 2 years, look at where we are now. Okay, as far as evidence-based practice, the way we cared for a COVID patient 2 years ago may look very differently right now. Make sense? Okay, disaster management. There's two kinds of disasters. What are they?
Natural and man-made.
Okay. Give me an example of natural. Give me some examples of natural.
Hurricanes, earthquakes.
Okay. How about man-made? What are man-made?
Biochemical.
Yep.
Some kind of terrorist attack.
Mm-hmm. Fires. Mm-hmm. Contaminated water. Okay. Know the difference. Know what the two types of disasters are, and examples of each. And that was one of your attestation questions. Okay. Healthy People 2020 objectives for disaster management. Go back to your book. Go back to your book and read that. Find that box and put those bullets on a card. Okay. Healthy People has extensive objectives for disaster management. Okay. And this gives you a summary of it, this paragraph, but please go back and read all of them in the book. This gives you some of their objectives. Preparing, alerting, caring for disaster within population. And they give one objective, 2 objectives, 3. I think they give 3 here. There's more than that in the book, so please go back and look at that. Okay. And then we didn't cover this in the case study, but we'll cover it here. Part of our role as a community nurse is teaching, right? How do we teach a family how to prepare for a disaster? Put together a kit. Okay, this tells you how. Okay, stock enough food for 3 days. Review the kit every 6 months. Why do we review it every 6 months? To make sure that nothing's expired. Does everybody in the family know where the disaster kit's located? Does everybody in the family know where to shut off utilities? We don't tend to think about those things in preparation, but as a community health nurse, part of our job is to prepare our community for disaster. We talked about this a little bit. What's the purpose of a mass casualty exercise? Right? The purpose of it is what is our response? To evaluate the agency response and capabilities. Right? Early response systems can decrease casualties. This is pretty much a standard practice in all businesses at this point. Okay, you have to have disaster planning. Okay, and then when a disaster hits, what's the most important federal agency that is involved? Right here, National Response Framework, the NRF. And what do? This tells you what they do. So maybe you get a question that says, pick what agency is the most important when a disaster happens? A, CDC, B, NRF, C, Department of Human Health, HHS, or DHS. Okay, so you need to know that this is the agency that's going to help with a disaster. Okay. This economic influences section, this goes along with case management. Okay. So a primary prevention strategy aimed at economic issues, and this is from the nurses perspective is to work with insurance companies to provide necessary coverage. Okay. That's one of your jobs as an advocate for your clients, right? Typically, in the past, we've had the approach of being reactionary and acute care oriented, right? But what we're trying to do is shift to a proactive primary prevention orientation. Okay. And that was the example I gave of a medication. You know, you have a client that can't afford a new medication. Okay. But you proactively think, after looking at the medication and looking at the client's diagnosis, that, you know what, even though they can't afford it, he still is in the hospital 3 times a month because he doesn't have it. So I'm going to try and be proactive and go and speak with the insurance company and see if we can get this approved, because it may save them money on the back end with not having other readmissions. Does that make sense? Those are the things you have to think through as a community nurse. And that's what this section, that was part of the case management chapters. You have to be thinking, we want to start shifting to be proactive, primary prevention focused. All right. If we can become more proactive and primary preventative focused, we might be able to have an impact in more cost-effective and more equitable healthcare. Does that make sense? That's our job in the community health. That's part of our advocacy. Okay, so take the initiative. That's what this is saying. Take the initiative. Okay, this next section is using health information. All right, so it's talking about when you're developing a community-based education. Okay, what is the first thing you need to do? You need to identify. Go ahead, go.
Assess.
What are you going to assess?
Find out what they know.
Yeah. What are you going to? Okay. How do you know what you're going to assess for? You need to determine the population. Right? First, you have to figure out the population. Right? You need to figure out, the nurse will determine the population the education is meant for and developed. Right? And then you start to go through your ADPI. Okay. So once you've identified your population, then you need to, so let's take our elderly population, for example. Then you have to identify, let's see, you're going to develop a health education for the elderly. Well, first you have to identify what are their issues, right? And then, because we're developing an education program, we need to know what our learning theories are. Okay. And what are our learning theories? Right here. 3 different domains. We need to know that. Remember, we talked about those last week? Guys, remember what they are? Without reading this? Affective is what? Feelings, right? Cognitive, thinking. And then psychomotor. What's psychomotor?
Movement of your body, like your muscles and stuff.
Right. But think about let's take psychomotor one step further right here. It's the teach-back method. As a community nurse, you may be, psychomotor learning focuses on performing a skill. So you may be teaching how to give an injection, how to change a wound, how to bathe a baby. Okay. And part of the psychomotor learning process is the teach-back method. Once you demonstrate, you want the client to demonstrate back to you. And that's what the teach-back method is. Okay. And that goes with psychomotor. Okay. And this paragraph talks about what the teach-back method is. Okay. Here's another some more information about when you're developing an education program. Okay, here's a whole bunch of guidelines right here. Make sure the program's message is clear, right? Keep the content limited to a number of points to avoid overwhelming. Use an active voice when presenting the content. Number 3, handouts and posters. Number 4, use stories. Number 5. Okay, so here's some guidelines for effective program development. So what kind of question might you get about program? If you're asked a question about program designing, what kind of question might you get?
The best ways to design an educational program.
Exactly. Select all that apply. Okay. And the other thing that's different about teaching and using health information is the difference. I learn different than you guys. Okay. You learn different than your kids. We all learn differently. Okay. So you need to know how adult learners learn. Adult learners all have different preferred methods of learning based on their generational characteristics. Okay, so here's a few examples. How did Generation Xers learn? How does the internet generation learn? How do the baby boomers learn? Okay, you have to understand those 3. They all learn in different ways. Okay. Next section, government law and policy activism. Okay, this first part is about malpractice, negligence. Okay. So for malpractice, topic is government law and policy activism. Here's the 3 conditions that need to be met for malpractice to be able to move forward. Okay, and there's your 3. Okay. And then as case managers, we're always we're striving to reduce risks, practice wisely within acceptable standards, right? And limit legal defense costs to professional insurance groups. That's your own, that you can decide, when you get your license, whether you want to get additional insurance. That's up to you. But in order to follow through with malpractice, all these three have to be met. Okay. Shepherd, we need to know about the Shepherd-Towner Act of 1921. What is it? Okay. So know this paragraph. We went through this in class. And there's a box in the chapter. There's a box that tells you exactly what it is. It's a longer version of this, but this is a good summary of what your Shepherd-Towner Act is. Okay, and then also in your chapter, there's a nice little box that has 3 columns. It talks about Healthy People 2020 goals from 2000 is on the left side. In the middle column, it's 2010. And on the right column, it's 2020. And the purpose of the box is to show you how the goals and objectives have changed or transitioned over a 20-year period. Okay, so the first goals were basic and focused on increasing years of life, reducing health disparities, and improving access to preventable services. Okay, that was in 2000. Okay, and you'll see this in the box. But by the time we get to 2020, 20 years later, how have those goals expanded from the original goals? Okay, well, one of the most important answers to that is the transition of these goals is focusing on more of descriptive outcomes. Okay, so what started as increasing years of life reducing health disparities and improving access to preventable services has turned into 20 years later this. Attaining high quality life, living longer, free of preventable disease for a specific focus. Okay, so there's your 2000 version with the same goal. Here's your 2020 version. Okay. What is the WHO? Got to know that. That's the International Health Agency that we look to, right? With their goal of attaining the highest possible health for all persons. Okay, and it gives you what services they provide. So if you get a question about World Health Organization, maybe it will say select all that apply of what the WHO provides, or pick one answer of what services they provide. But here's a list of what they do. Okay, another agency that we need to be familiar with is the Agency for Healthcare Research and Quality. Okay. Center, CDC. I'm going to highlight a few things here. So this paragraph gives you 4 different agencies. Okay, so this, the WHO is your international agency. Okay. The next paragraph has 4 different agencies and what their responsibilities are that all have to do with community and public health. So you need to know the definition or what service they're responsible for. So maybe put these on a card. Okay. Maybe you're given a scenario to say, who would be the agency that would handle this? Give you a scenario and you'd have to pick one of those. Okay, case manager. Okay, you can read through this. We just went through this. We at least know what a case manager does, right? But here's a little bit more information about case management, right? Case managers work to meet the health and well-being of clients through the coordination of care. That is the crux of case management, coordination of care. And, just because I'm just highlighting as I'm talking. You need to be responsible for all the information on the study guide, not just what I'm highlighting. Okay. And then violence and human abuse. Okay, we talked about this last week. Primary prevention begins with a community approach that incorporates strategies from key stakeholders. If you're trying to conduct primary prevention interventions in your community, okay, what's a primary prevention? Education. Yep, education, prevention. Well, violence and human abuse affects a lot of people in the community who might be some stakeholders that you'd bring to the table that have to come to the table to come up with a plan of how to reduce violence. Well, here's some examples. Criminal justice, education, social services, community advocacy, public health. And then we covered this last week in detail. Here's some examples of what communities have done to reduce violence or prevent violence. So you might get a question that says select all that apply. If you're in a community that has and you're part of a team that wants to reduce the violence in your community, what are some strategies that you might implement as a primary prevention? Okay. And with regards to the infectious disease and prevention, that was last week. That's a pretty important statement right here. Vaccines are one of the most important, effective methods of preventing and controlling communicable diseases. Okay. you need to be, if you're working in the community, you need to be aware of actually this entire paragraph, because this is what you do. This is what I've done for years as far as education with the parents and the staff and the principals. Okay. Most people don't understand that, you know, kids shouldn't not be at school if they're not vaccinated. Okay. So this is all about immunizations. Okay. So have a look at that. And it also gives you some examples of what populations are at higher risk for having a lower compliancy rate. Okay, talks about inner city kids from minority and ethnic groups. It talks about kids in religious communities that maybe want a religious exemption. Maybe parents don't believe in vaccinations. And it also talks down here about adolescents having a lower rate. So there's 4 or 5 groups that they mention in here that are less likely to have high compliance rates. Okay. And then the chapter from last week that talks about the 4 major infectious communicable diseases. Remember, HIV, hepatitis, TB, and STDs. Okay, well, here's a good little synopsis on STDs and why it's important we need to know about these, right? And it specifically talks about bacterial STDs and viral. Bacterial STDs that can be treated and viral that can't. Okay, and what happens if you have a viral STD, say like syphilis, that can be transmitted transplacentally? What happens? What's transplacentally mean?
Transfer to the baby.
Yeah. What happens if it's untreated? Serious problems within a few weeks. Gives you specific examples of untreated syphilis can cause. Okay. Okay, and then we just talked about this surveillance outbreaks. Okay, it's a lot of this information and surveillance and outbreak is in your rationale from your case study. Okay, we need to talk about patterns of occurrence. All right, we just went through that. Right, what's a point source outbreak? What's an intermittent outbreak? Right, what is a propagated? Okay, so you need to know different patterns of occurrence. Mixed outbreak. I think there's 5 of them in here. I've got to 4. All right. Why are surveillance systems essential to protecting the public safety? All right. Because they help with surveillance, helps with early detection. Maybe early interventions to try and reduce morbidity and mortality. Right. What's the difference between observation and surveillance? Talks about it right here. Purpose of observation and the purpose of surveillance. Understand those two. Okay, and here's your surveillance systems are here. All right, we have a passive system. We have an active system. We have a sentinel system. And we have a syndromic system. These are 4 surveillance systems. So this is definitions. What's the difference between observation and surveillance? What are our 4 surveillance systems? What are our 4 or 5 patterns of occurrence? And these paragraphs give a nice little one or 2 sentence summary of what each of these are. Okay. Okay, and here we're talking about developing community-based programs. All right. What's the very first thing we have to do when we are talking about community-based programs? Very first, number 1, right here, conduct a needs assessment. How do we know what we're going to do if we don't know what the need is? Okay, well, during your needs assessment, right, you have a couple of stages. You have your preactive stage. You have your reactive stage. It tells you exactly what each of them are right here. Your inactive stage and your interactive stage. Okay. So for example, during the preactive stage, maybe the nurse is going to project future needs. Just looking at an Amber Alert that just came across on my phone. Okay, what are some program planning models? Okay, we have 3 of them. We have the patch model. Okay, and these are for program planning. Okay, so we have 3 different models to be familiar with. The patch model, which focuses on mobilizing the community. Okay. And then we have the second one is the assessment protocol for public health model. That's number 2. And then we have the MAP planning. Okay, so these are program planning models and they all have a different focus. So you might get asked a question or given a scenario that you're planning a community assessment. Here's the scenario. Which model would you use? Okay. I want to quit in a few minutes because I want to do our attestation questions. Okay, and this is a great section on managing quality and safety. Okay, it talks about what is continuous quality improvement, what is quality assurance. If you understand the difference between these two, and they're outlined here, you understand this whole section. Okay. Part of quality measuring outcomes is the tracer method. Okay. One of the things about it measures the process and outcomes of care. However, what do we remember about the tracer method? There has to be certain scenarios that all fall into place in order to be able to be participatory in a tracer method study. And here they are. They have to have the same disease, the same stage of illness, similar lifestyle, similar intervention, and live in the same community. Okay. This is an excellent paragraph outlining tertiary prevention with regards to quality improvement. Okay, gives you several examples. Excellent information on tertiary. Okay, and then lastly, when evaluating programs, you need to know that there's different stages. You have the structure phase, okay, which explains to you what it is right here. Then you have the process phase, which you can read what it is. And then you have the outcome phase. All right, so this is all part of how you evaluate quality programs. And it gives you the 3 phases you use. So maybe you're presented a scenario and you're presented a scenario of evaluating quality improvement programs, and you're asked which phase the scenario addresses, structure, process, or outcome. Okay, next is ethics. Okay. What we need to know what the ethics chapter is, you need to know what the ethical principles are. Okay. So you have a principle of respect. You have the principle of beneficence. And then you have the principle of justice. Okay. Those are your ethical principles. And then you have ethical theories. Okay. You have your utilitarianism theory. And it tells you exactly what it is. You have your deontology theory and distributive justice. Okay, so there's your 4 theories that you need to know about. Okay, and it tells you what each of them are: utilitarianism, deontology, distributive justice, and consequentialism. Okay, a lot of definitions. A lot of definitions in the study guide. I get it. Okay, and then feminist ethics. What does that look like? You need to have an idea of what feminist ethics are focused on. We know that they advocate for social, political equity and reject abstract rules and principles. Okay, so we need to know what, oh, hang on here. It's a few definitions. What does feminist ethics focus on? What is virtue ethics? Okay, what is non-malfeasance? Okay, and caring ethics. Okay, there's a whole bunch of definitions there for you. Okay, and then you can read through this. This is your cultural competence that we talked extensively about. Okay, well, actually, it's the last section, so let me just highlight a few things. We need to know the difference of refugees and immigrants. What are the different challenges for both? How do we work with immigrants? How do we work with refugees? A lot of the barriers are similar, but there are some distinct differences. And this information helps you figure that out. Okay, and it gives you a couple of different cultures. A couple of examples: the Native American culture and the Hispanic culture. Okay, there's a box back in this chapter that has 4 sections. It has 4 different cultures. And I highlighted this in the book when we went through it last week. Okay, it has the Asian culture, the African American culture, the Hispanic culture, and the Native American culture. And it goes through what their beliefs, what their attitudes are in certain, touch, feel, communication, homeopathic, communications with health providers. They all have their different cultural beliefs and attitudes. And that's the whole discussion we had early on about cultural competence. Okay. And you can go through how to set up your math calculations. So there's your study guide. Before I get some feedback, can everybody go to their attestation? Everybody go to their week 8 attestation, please. First question, somebody read out the first question, please.
What are the 2 types of disasters, and please give an example of each?
What are what? Oh, yeah. Okay. So what are they? Oh, wait, hang on. Ashley is taking one for the team. Ashley just put in the chat already what the answer is. Ashley, you did this for us last week too, didn't you? What do you guys say to Ashley? Again.
Thank you, Ashley.
Welcome.
Ashley, you're on top of this, girl. Thank you. So did everybody see what Ashley put in the chat? Oh, Jane's on top of it with number 2. You guys are a lucky group of students. Your teammates are right on top of it. Can you guys see the chat, what these guys put in there? Love it. Yep, that's exactly right. Excellent, 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 Jane. Great, great, great. So there's your 2 answers to your questions. Okay, so submit that and you don't have to think about it again. All right. I'm really kind of not being, I'm just hoping, since it's a holiday week, I'm hoping that everybody gets their attestation in by Sunday. If you're here today, there's no reason to not fill it out and send it. Okay, I'm going to send out an email later on when I get this recording to everybody about this recording today and yes, and the last recording. Okay, and